The information and tips on this show is not intended as a substitute for personal medical advice. Before making any decision regarding your health, please consult a physician or other qualified healthcare practitioner.
Hello and welcome to African American Health Matters. Well, African American Health Matters is a new mobile health text message and multimedia outreach that gives health tips and reminders to our subscribers right over their cell phones.
Yes, it actually gives them their health tips for things like remembering to take your medication, tips on handling diabetes, hypertension, losing weight, and also breaking all those bad habits.
Now, you can register online and get health text messages on your cell phone by going to www.africanamericanhealthmatters.com, or you can call our 800 number, which is 1-800-677-8441. That's 1-800-677-8441, and somebody will get back to you probably within 24 hours to get you registered.
Now, you know, African American Health Matters kicked off a little over a year ago as part of the National Physician and Family Referral Project. It's known as NPFR, and it is a division of 50 Hoops. Well, there are critical numbers of African Americans dying from prostate, breast, lung, and colon cancer, but a lot of times it's treated too late. Now, even more African Americans are affected by diabetes, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we're still needing continuing education and more information about HIV and AIDS. Our surveys show that we need more ways to access resources available in our community.
Yes, and Papa, do you know what? There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. What we need to do is educate more people about the importance of clinical trials.
I agree completely. And the only way to do this is to participate in new drug discoveries. Now, Ed, you know, racial disparities in healthcare for African Americans and other minorities, including underserved, is very high. And that's why we're so happy to have great partners within our African American Health Matters.
You're absolutely right. And each week we want to recognize and thank all of them.
Each week, we bring you tips from our African American Health Matters text message service. So here's some for this week. Go ahead.
Here's one on heart palpitations. A study by Mayo Clinic found that blacks are less likely than whites to know that they have atrial fibrillation.
Okay. Lung cancer. Did you know that black men are hardest hit by lung cancer? Don't be a statistic. This comes from our partner, the American Lung Association, and their website is www.lungusa.org.
Here's one on fighting gravity. Gravity is important in keeping acid out of the esophagus. Keep your posture upright, especially after eating, for proper digestion. This comes from www.lifescript.com.
Oh, this is cute. It's on weight. Pig out and lose, it says. The secret lies in choosing high-volume, low-calorie foods like fruits, vegetables, salads, and lean proteins. This is one of our favorites from www.lifescript.com. Here's another video and cool tool from medlineplus.com.
Allergens like pollen are nothing more than foreign plant antigens. When they get released into the air, you can see and hear the result. As part of the body's non-specific immune defense, the stimulus for sneezing gets triggered when allergens first enter the nasal tissue. Pollen allergens encounter the plasma cells in the nose, which respond by producing antibodies. These antibodies attach to mast cells, which are white blood cells containing the chemical histamine. As more antibodies are produced, they cause the mast cells to release histamine. Histamine then produces allergy symptoms. A stuffy and runny nose, sneezing, and watery eyes help to remove the invading pollen. Medications called antihistamines may be used to help alleviate severe allergy symptoms.
Elise Cook, she is Associate Professor in the Department of Clinical Cancer Prevention at the University of Texas MD Anderson Cancer Center. She's board certified family physician specializing in cancer prevention of the institution's Cancer Prevention Center, the CPC. Really good about Dr. Cook is the fact that she has a couple of interests that are right on point for this show. One of those is minority recruitment and retention into clinical trials, and the other is cancer health disparities. So, hello, Dr. Cook, and we're very happy to have you here.
Hello.
Just a few questions on clinical trials. Just what are clinical trials and why are they done?
Clinical trials are studies that are performed on humans, and these studies are used for treatment, they're used for screening. We have prevention trials, and we use clinical trials to determine if a diagnostic test is usable. For example, there was a clinical trial for mammograms to see if it was a good test to screen for breast cancer. We have screening trials to see different ways of screening patients. And we have prevention trials. These are trials of healthy people and seeing if we can prevent diseases. We use those a lot in cancer. They're also used in cardiovascular disease. We have treatment trials, of course, those are the main trials, and those are to develop new therapies, to test new therapies to see if they can to treat a disease, and also to look at side effects and those types of things.
Yeah. Well, we've talked on our show a lot about the importance of African Americans and minorities participating in trials, that we should not leave it up to Africa and Brazil and other countries to test the drugs that are going to be used on our bodies. So, Dr. Cook, tell us, why should minorities participate in clinical trials?
Certainly. African Americans should participate in clinical trials because we have a certain diet. In this country, we're quite different from Africans in Africa, and definitely African Hispanics and Black Hispanics in Brazil or other countries, because of our diet, our body makeup, and the stresses that we have. If we don't participate in clinical trials, then the studies may not be valid for our population, meaning that the drug may not work as well for African Americans as it does for white Americans.
Right.
And or that may have side effects that are present only in African Americans, and this was not discovered when the trial was being conducted. This is also true for Hispanic Americans, Asian Americans, and Native Americans. So all minorities should participate. And when you're looking at diversity, you also look at the poor and the elderly to participate in clinical trials. These are populations that are underserved in clinical trials.
In looking at some of the numbers, sometimes you wonder if the percentage of African Americans and other minorities that are participating in the trials is equivalent to the percentage of the populations here in the United States. And I know with the new 2010 census that a lot of things did change. How do you feel about the percentage of African Americans and minorities in clinical trials at least equaling to the percentages of the population, or is that important?
I think it's important, but what's also important is to look at the percentage of the population affected by the disease.
Okay.
And this really becomes important when you look at something like prostate cancer.
Absolutely.
Although African American men, the African American population is only about 13%, when looking at folks in that age range, which would be over 50, that typically get prostate cancer, but the numbers of men that get prostate cancer, African American men are 60% more likely to get prostate cancer and twice as likely to die from it.
Yes.
So in that population, you'd want to oversample what is the number of African Americans in the community. And when you look at Hispanics, that's a very large group, but it's a very young group.
Yeah.
And Hispanics also have that Hispanics paradox, where they may get a disease, but they're not often affected with the mortality or the morbidity that occurs with a disease. For example, they may get diabetes, but they don't get as much kidney failure, say African Americans get.
Okay.
And they don't get as much cancer. So that population, you would go more toward what is the population at large. You might even go less than that, because the population, you wouldn't go with the total population. You look at that age range for that population, because they're so much younger. So those are two very different populations, and are affected by diseases differently. African Americans are very unique when it comes to cancer. For most cancers, most of the large cancers in this country, we get more of the cancer, and we die more than anybody else with it.
Wow.
There's a few exceptions, and one is breast, which is kind of worse. We get less of it, but when you look at the same population, we die more. It's so severe that even though we get less, we die more than anybody else of it.
Yeah, and I think that goes right into the question of why. What are the obstacles to minority participation in trials that could possibly resolve some of these mortality rates?
Well, there's some of it has to do with fear and previous treatment. We don't have a good track record as health professionals, how we've treated African Americans in the past. So there's the respect issue.
Yes.
There's also a fear of being treated like a guinea pig, that fear. Yeah. And there's also other issues, the financial issues. A clinical trial, for example, a prevention clinical trial, isn't covered with the new healthcare reform act. It isn't. If it's not a treatment trial, it's not going to be covered. So those aren't covered. So patients may be afraid of having to pay out-of-pocket expenses. And that can be cleared up by simply asking the researcher, will I have to pay, for the research to participate in the study? The other thing is hidden costs. If you participate in the study and they only are able to examine you and discuss the trial with you on weekdays, and you work Monday through Friday from 8 to 5, and you aren't able to take a day off work to participate in the clinical trial, then that's money you lose and can also lead to, loss of employment because you're away from work. The other thing is the clinical trials, they have some of the eligibility criteria do not allow people with comorbid conditions, and those are other problems.
That's right.
If you have high blood pressure and other problems, then perhaps you're not able to participate in a certain trial. Well, these restrictions do keep minorities away from those trials.
Oh, okay.
Because we tend, as a group, to have, I am an African-American woman, we tend to have more of these diseases than our non-minority counterparts.
Yeah.
African American males die more frequently from sudden cardiac arrest due to hypertrophic cardiomyopathy, or HCM, than any other demographic. There are warning signs, and there are steps that you can take to protect these young lives. Learn more about hypertrophic cardiomyopathy and sudden death in the young at 4hcm.org, which is the number 4hcm.org. Take care of those young lives. They've got promising futures ahead.
Staying healthy is important, and nothing impacts your health more than your weight. Take the Your Weight Matters campaign challenge today and learn more about your weight and health. Visit www.yourweightmatters.org today to take the campaign challenge.
Hello and welcome to African American Health Matters. Today we have with us Dr. Doris Browne, President and CEO of Browne and Associates, Inc. It's a health consulting company that addresses the health status and disparities of national and international populations through the use of health information and communication technologies to enhance positive health outcomes. Dr. Browne has more than 30 years of experience as a leader and expert in the medical management of radiation casualties, women's health, breast cancer, and HIV/AIDS. Dr. Browne.
Hello.
Hi, we've got so much stuff to talk about, Dr. Browne, and you have such extensive credentials. So you're going to sort of be our resident expert on breast and colon cancer for the time being, if you don't mind taking that role on.
Thank you.
Because I know you've got a lot to say. I guess one of the first questions would be, we usually jump right in the middle of cancers, and we're going to dedicate this half an hour to breast cancer. But what is the causes of cancer in general? Let's just kind of get the generalities out of the way.
Well, yes. I think the first thing that we should understand that cancer, of course, it's a very dreaded word, and most people fear it when you hear it. And years ago, in our parents' era, they did not want to talk about it and whispered the big C or it or things that we did not want to discuss. But, of course, now we're beginning to talk more about it. And cancer is really an overgrowth of cells where cells, due to various targets, start to grow in an abnormal path. And when they start to grow, they then grow in a rapid way, and it becomes what we call malignant, and that is the cancer. Where normal cells tend to grow and divide and grow and divide and stay within their lane, if you will. But when the cells begin to grow in a more rapid rate, and sometimes it is due to many factors, and of course if we really knew the answer to what actually causes cancer, we would have a Nobel Prize and we can put an end to this. But there are some factors that we are very much aware of. Many cancers are caused by viruses, such as cervical cancer. We know that 90-some% of the cervical cancers are related to the human papillomavirus. Some liver cancers are caused by the hepatitis virus. So we know that there's a correlation between some cancers and viruses, and then others that are related perhaps to radiation that we are exposed to that may have some impact. Lung cancer, we know, is directly associated with smoking, tobacco, sometimes, and even in the sense of secondhand smoke. In terms of breast cancer and colon cancer, the answers are not quite as clear. We know that there are some genetic factors that will play a role in these cancers. There are also some familial things. And so to say that we know the actual cause of what starts these cells to grow abnormally, we are uncertain. But cancer is becoming a chronic disease nowadays because we have made such advances in terms of our technology that we can pinpoint certain risk factors for these cancers, and we are trying to encourage people to get early screening to get the cancer diagnosed in an early stage, and therefore we can treat it. We are also working very hard to come up with preventive agents or changing our lifestyle that we can prevent some of these cancers.
And, since we want to kind of focus a little on breast cancer, I was going through a quiz, and it was just like, very simple questions like what the most common symptom of breast cancer is a lump. And it said true or false. Well, I guessed that wrong. I guessed it false. And it said that the majority of breast cancers present themselves as a lump in the breast, but that said, not all lumps in the breast are cancerous, and that all breast cancer lumps can be felt. So what is your take on that?
That is very true. Yes, the majority of cancers that are detected, we or the individual will feel the lump, but not all lumps, as you indicated, happens to be cancerous. There are many benign, non-cancerous lesions, and in younger African American women, we have what is called dense breasts, so there's lots of lumps and cysts and things that we have in our breasts that it's not cancerous. And so the idea that with breast cancer, and many times you have no symptoms at all. It's not a painful lump. You can have painful breast lumps that is more of an inflammatory breast disease, and of course that is an uncommon type of breast cancer. When women find a lump, it is important to go and have that lump assessed by a healthcare provider. You need to get a mammogram, you need to have a sonogram or some other test to really determine, is this a lump that we need to biopsy? Is this a lump that we can just watch and see if it is cancer? Because in order to tell if it is in fact cancer, you have to have some cells, and those cells have to be looked at under the microscope and then tell whether it is a benign lesion or a malignant lesion.
Well, Dr. Browne, what actually are the risk factors for breast cancer?
Okay, and for all women, and then I'll go into African American women in particular. But being a woman is one of the risk factors. And then age, as we get older, our risk for breast cancer increases. We look at other factors such as your family history, and there is a correlation. There is a breast cancer gene that I'll talk about in just a bit. When you started your period, if you have reached menopause, when did menopause occur? So the number of pregnancies that you've had. So these are what we consider risk factors. Now, those are risk factors that we can't do anything about. And I should add that about 1% of the male population also get breast cancer.
Yeah, we forget to ask about that. That's true. Yeah.
So just being a woman puts us at increased risk, but men are not out of the woods because 1% of men can also get breast cancer.
Yeah.
When we talk about the risk of breast cancer increasing as we get older, we have to also take a step back because the number of new cases of breast cancer, of course, is very low in the African American population in those women that are over the age of 50.
Really? Okay.
But African American women die more from breast cancer than the non-African Americans or Europeans, as you want to call it, or whites. But we know that young African American women less than the age of 44 have a higher incidence of breast cancer, and they also die at an a more rapid rate.
Why do you think that is, Doctor?
And we're beginning to now understand that in the past we've thought of breast cancer as being one disease, and that you either would have it as what we call premenopausal below the age of 50 or postmenopausal after the age of 50. But what we're finding as we begin to look more at various factors, education, socioeconomic status, genetic makeup, family history, all of those factors are taken into consideration, and we're beginning to find that with new technology, and this is looking at a molecular profile of breast cancer, we have now been able to divide it into 5 different subtypes, and we also have some biomarkers such as your estrogen receptor and your progesterone receptor and another oncogene called HER2/neu, that those markers, again, tend to fall into a category where you may have heard the term triple-negative breast cancer.
Yes, I think that's becoming better known out there. True.
Yes, well, that is one of the subtypes. It's a basal-like pattern that we're seeing in breast cancer, and it happens to occur more frequently in African American young women and in those women that have the BRCA1 gene. Now, we know that the BRCA1, and some people call it BRCA, BRCA gene mutation is more commonly seen in the Ashkenazi Jewish population.
Okay.
So we have this subset, young women, African American women, and those with the BRCA1 gene that tends to get this triple negative breast cancer. And this is the breast cancer that we're seeing in very young women, some in their 20s, certainly they are below the age of 45, and it is a very aggressive kind of tumor. So we're looking at the biology. What is it about these cells when they do not have the estrogen receptor, they do not have the progesterone receptor, and they do not have the HER2?
Staying healthy is important, and nothing impacts your health more than your weight. Take the Your Weight Matters campaign challenge today and learn more about your weight and health. Visit www.yourweightmatters.org today to take the campaign challenge.
It's true. As African Americans, we have the highest risk of being diagnosed with colon cancer. The good news is that this is a cancer we can do something about. Find out the facts. Talk to your doctor about getting a screening test starting at age 45. Learn more by visiting the Colon Cancer Alliance at www.screenmycolon.com or by calling 877-422-2030. That's 877-422-2030.
Think you're addicted to food? You may be right. Researchers from Yale University wanted to know if some people's brains react differently to food, the way substance abusers' brains react to drugs. First, they asked 48 young women to answer a questionnaire to determine if they had symptoms of addictive-like eating behavior. Then, they hooked the women up to a machine that measured their brain activity while they tasted either a chocolate milkshake or a liquid with no flavor. Women who scored higher on the food addiction quiz had more activity in certain regions of their brain when they were expecting food. These regions play a role in urging us to eat and are the same parts that motivate people with substance dependence to use drugs. People with higher food addiction scores also had less activity in certain areas that help put on the brakes after a tasty treat. According to the researchers, food advertising could make it hard for some people to stick to a healthy eating plan because of the way their brains respond to the ads. I'm Dr. Cindy Haynes of Health Day TV with the news the doctors are reading, health news that matters to you.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com, or you can call at 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
We want to thank our physicians, speakers, and guests for joining us on Cyberstation USA, and we want to thank Cyberstation USA for their support and vision for African American Health Matters on Cyberstation USA. Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyberstation USA.